Traditional medicine has enjoyed a place of utmost importance in the healthcare system of Sri Lanka for centuries. Continuing this recognition to the modern age, the milestone Ayurveda Act No. 31 of 1961 entrenched the system in the legal framework of Sri Lanka, then Ceylon, and set an example to the world. The Act laid the foundation for the present administrative structure, governance, regulation, and development of the sector within a modern healthcare system. The Department of Ayurveda under the Ministry of Health is the overarching regulatory body for traditional medicine in Sri Lanka. This department is responsible for overseeing the functions of three regulatory authority bodies governing various aspects of the traditional medicine system in Sri Lanka. They are the Ayurvedic Medical Council, the Ayurveda Education and Hospital Board, and the Ayurveda Research Committee. The Ayurvedic Medical Council serves as the chief purpose of being the licensing and regulatory body for traditional medical practitioners of Sri Lanka, as well as Ayurveda, Siddha, and Unani medical officers, Ayurveda nurses, and dispensers. Headed by the Commissioner of Ayurveda and inclusive of practitioners and university lecturers, the Council has the duty of maintaining high standards of professionalism and ethics amongst the 22,000 registered traditional medicine practitioners and the 3,000 registered Ayurveda, Siddha, and Unani medical officers. The Ayurveda Education and Hospital Board regulates undergraduate and postgraduate education of traditional medicine systems in Sri Lanka, and carefully curated curriculums are taught in universities across the country by accredited lecturers and professionals. The curriculums, as well as the courses, examinations, and diploma awards and certifications, are scrutinized by the board, and rules, regulations, and SOPs are developed to ensure high standards of education. The university system alone has produced over 3,000 graduates from this discipline who have received a high standard of education in the various systems of traditional medicine. Not only does the board regulate the curriculums in Ayurveda universities, but also the operation of private Ayurveda educational institutes. Whilst current practice and education are regulated separately, the Act also places special importance on research and development, essential for a thriving medical system. The Ayurveda Research Committee is in charge of directing and monitoring the progress of all research activities in the field of Ayurveda and is responsible for the Pharmacopoeia and Ayurveda Formulary Committee. All Ayurveda and pharmaceutical products, production processes, and services are regulated by the Formulary Committee under the Department of Ayurveda, in line with the Ayurveda Code before they are launched to the market. This includes the review of advertising and labeling of products in accordance with specific rules and standards. Meanwhile, the traditional and complementary medicine services are regulated by the Code for Services under the Ayurveda Act. Provision has been made to register Ayurveda wellness centers, private hospitals, and dispensaries, as well as Ayurveda centers in hotels and resorts, and to monitor and evaluate their operations. This is a shining example of how the regulatory system complements the lifeblood tourism industry of Sri Lanka. A well-functioning regulatory system is the cornerstone for checks and balances required for the preservation and advancement of an industry, and through the Ayurveda Act, and the government institutions, Sri Lanka has ensured that beneficiaries only receive the highest standard of services.